welcome you to today's session where we are discussing about allergies in children. My name is Dr. Dickens Lubanga. I'm a pediatrician based at Bungoma Children's Hospital. This topic is important because most of our children actually they get allergies a lot, and most of the conditions that we tend to see in children, most of them resolve around allergies. So, for the viewer who is watching us today, um, we are saying that allergies are normally reactions by the body. They are not normal reactions, and they are normally given a number of people who have got these reactions, and so they might go all the way from the skin, from itching of the skin, all the way from sneezing, all the way from having a rough skin, dry skin, and all the with digestive issues. So all those things are actually as a result of allergies. And why do allergies develop? Usually, allergies is a result of an immune system that is not well matured. So you find ideally when you are born, most children do not have enough immunity because they get it as they continue interacting with the environment. And so you find during that processes, they are normally prone to getting infections, and also their bodies are not able to basically defend themselves. So allergies are as a result of a weakened immune system that does not know how to differentiate between uh, bacteria, for example, or viruses, uh, or fungal infections, which ideally will not cause, which are actually harmless. So there are some organisms which are harmless, and so they do not need your immunity to respond to them. But again, there are some organisms which are harmful. So there are those bacteria which are harmful, there are those viruses which are harmful. And so these ones are the ones that actually your body should be able to react on. And you see now the process of building up the immunity requires that the immunity is built up to identify both the bad bacteria or viruses and the good ones. So that if they're able to identify, then they are not able to react on harmless substances within the environment. And so for those people who have got allergies, it just means that your body is more sensitive. So in case there's dust, for normal people, if there's a high volume of dust, is when probably your body will respond. But for people with allergies, even just a minute exposure to dust evokes these allergic responses. Um, there are those people whom, again, just a small exposure to cold. You just go in the cold, or you've taken cold shower, then you find you start sneezing and start having all those other complications. And this is just because you have allergies to cold, and that's why you might respond that way. So we are going to look at how you can identify that if someone has allergies or if a child has allergies. Number one, most of the time they tend to have recurrent upper respiratory tract infections, that is like flu, and also allergic rhinitis. So allergic rhinitis just means that you're coughing, you're itching, you're sneezing most of the time. And most of the time, it tends to last longer than a normal cold or flu to a person who does not have allergies. And most of the time, they'll have to go to hospital to seek medical care because of the worsening of the conditions. A second type of allergy that mainly occurs in children is called eczema or atopic dermatitis. So eczema or atopic dermatitis usually affects the skin, and you are going to see these children have got a dry, itchy skin, and sometimes you might get that the only clue sometimes that will give you is that you'll find an even skin color or skin texture. So you'll get some sides of the face are brown, some other parts of the face are dark in color. So most of the time we normally know that those are just eczema, and it tends to occur quite often in children. You might also have other forms and other types of skin diseases. Some of them will get seborrheic dermatitis. Some of them will also tend to affect the flexure surfaces, because some of these allergies might eventually lead to autoimmune conditions that will tend to affect those joints and also tend to affect the skin. Now, there are also other allergies that may be because of food intake, and majority of them uh, tend to occur, especially when you take proteins, animal proteins, and also peanut. So that people will react. Um, who will react either by taking peanut. You might see them with severe abdominal pain. You might see them with severe diarrhea, or even sometimes they might even have they might actually vomit after consuming the food that they have allergies to. For children, most of the time you'll see them after consuming specific foods that contain that have they have allergies against. You'll see them with big lesions on the skin sometimes that are itchy. They pop out of the skin, and usually they are slightly bigger. Sometimes they can also be itchy. So usually it will tell you, and this happens immediately after taking that food. So if you're allergic to either eggs, if you're allergic to fish, if you're allergic to beans, so those are the symptoms that you might actually get. Then there are these extreme reactions, which are called anaphylaxis. So there's some people again who have got allergies, and those ones, the extreme allergies, we call it anaphylaxis. So that there's some people who can be stung by things like bees, things like wasps, and they start swelling everywhere. They develop airway edema. So that means that they'll have difficulties in terms of breathing. They'll start even wheezing, and they'll have conditions that can actually, which are life-threatening, which can even cause death. So these ones are extreme. Even there are some who consume substances like peanuts, and they actually evoke such kind of responses that might actually force you to go to the hospital. Other allergies, which most people will call asthma. Ideally, asthma is just a chronic condition. It comes in especially um, when there's airway congestion, there's a lot of edema within the lungs. And so these patients will tend to wheeze or hear noisy breathing sounds right from their lungs. And usually it's worse at night, especially when it's cold. And sometimes it's better during daytime symptoms. So there are those ones that have got extreme nighttime symptoms, and those ones that have got daytime symptoms that are not on the extreme end. So, and asthma develops after repeated attacks, and that's why we make a diagnosis at least for older children, not necessarily for younger children, because you understand that the immunity is still developing. So you cannot classically call it asthma in the earlier periods of their growth and development. So asthma is a chronic condition, and but that one we manage it by trying to avoid the triggers, and also by putting the children on inhalers. We classify the asthma depending whether it's mild, moderate, or severe. So the classification will depend on which kind of intervention that we give within the hospital. So, so how do we treat these patients with allergies? Number one is that allergies have no cure, but they can be controlled. So, because ideally it means to cure, it means either we have to change the environment, which is not possible to change the environment, and you cannot change the individual. So, one is either we strengthen the individual to be able to withstand the environment, because you cannot run away from the bacteria, from the things, from the dust that is there in the environment. You must encounter it. Uh, but you can try to minimize exposures to the different kinds of allergies that you have. So if you're allergic to a given thing, let's say eggs, then we'll actually ask you to avoid taking eggs. If you're allergic, let's say to meat or beef products, then we also ask you to stop consuming those specific ones. If you're allergic to cold, we also ask you to keep warm, because again, cold environments, you can get them anywhere and at any given place. So it's difficult to control the environmental condition. But for you, you can be able to adapt based on the conditions that we have. For those children who tend to get allergic rhinitis or flu that sometimes takes quite a period or even to respond, sometimes we encourage mothers to vaccinate them against vaccines like flu or influenza vaccines. Remember, these vaccines help your body to introduce the flu pathogens within the body so that your body is able to recognize them. Remember we said that when you have allergies, your body is like they get shocked when they meet that a pathogen continuously. So when you introduce this in your body, then the body looks at it like, this thing I've come across it, so I don't have to react over it because this is something that is not strange to me. So we tend to vaccinate them so that we reduce the levels of flu that they tend to get. And for those ones with asthma, we have got a management plan for them. Either those ones we put on inhalers, and we have two types of inhalers. There are those inhalers that prevent an asthmatic attack. There are those ones that we use to treat an active attack. So in children, most of the time, we'll tend to prevent, unless if we have severe forms of asthma that we introduce a second inhaler for them to be able to utilize. Now, for those ones who have got anaphylactic reactions, ideally they have to be seen in the hospital. Sometimes even we admit them. There are drugs that we give them to avoid this anaphylaxis. Either way, allergies are there with us. We have a lot of allergies within us. Bungoma itself, actually, there are so many patients with a lot of allergies. And the main thing we are saying is that allergies can be controlled, but we are saying that there's no cure for allergies. But we can train, we can help people to live with the allergies. Thank you.